Funding for the Maddy Report is made possible by grants from Comcast, the Spencer Family, Chevron, Community Health System, Harris Ranch Resort, Producers Dairy, Caleb and Desiree House, Valley Children's Health Care, and The Wonderful Company. Additional support provided by from the Maddy Institute, the Public Policy Institute for the Valley's public universities. This is the Maddy Report with Executive Director of the Maddy Institute, Blake Zanti.
Welcome to the Maddy Report. Today we'll be discussing prominent healthcare challenges and changes in the Central Valley based on the healthcare landscape analysis commissioned by the Central Valley Community Foundation, with guests Dr. Elize Bradley, Senior Health Equity Fellow for the Central Valley Community Foundation, Rosemary Rahn, Kings County Public Health Director, and Traco Matthews, Chief Health Equity Officer for Kern Health Systems and Board Chair for Governor Newsom's Racial Equity Commission. Elize, Rosemary, and Traco, welcome to the Maddy Report. Thanks for being on the program today.
Thank you for having us.
Thank you.
Well, let's start talking about the healthcare landscape analysis that was published by the Central Valley Community Foundation. Elize, can you give us a brief overview of the genesis of the healthcare landscape analysis? The Central Valley Community Foundation engaged in extensive research and community outreach during the development of this report. Why was it commissioned, and how did it come into being?
Well, it's an interesting story. I'm relatively new to Fresno. I spent 15 years at Kaiser Permanente in the Bay Area. And when I moved here and started at the foundation, I was curious why everyone was complaining about health outcomes, about access. And so I asked around, was there any kind of comprehensive report or something, a document or documents to which I could turn to learn about this ecosystem, this healthcare ecosystem in the Central Valley. And I asked around as I tried to embed myself in the community, asked around and couldn't identify anything. And so I went to our CEO, Ashley Swearingen, and said, Ashley, I'd like to do this study to get some baseline, some information. Everyone's complaining, but I can't find any source document that would give me any explanation. So she said, yes, definitely do this. But before you do that, make sure you check with Bryn Foran, who is a healthcare policy expert here in the area. And so I checked with her and I asked 3 questions. 1, has a study ever been done? 2, if not, should one be done? And then 3, if one should be done, is the Central Valley Community Foundation actually the right entity to do it? Her response to all of these was no, it hasn't been done. Yes, it should be done, and absolutely the Central Valley Community Foundation should do it. But she said, before you go further, just check in with David Bocci at the Hospital Association to make sure he was unaware of anything and ask him these same questions. His questions were the same. And so we set out, we identified some funding within the foundation that had been provided by Anthem Blue Cross. And so we put together a group, an advisor group, Rose is on that group, to authorize us to use the funding. And voila, we hired a consultant, and Jess Thatcher Consulting. Jess had been the former Chief Impact Officer for the California Healthcare Foundation. So she put together a dynamic team of women, and we pursued this study starting in May of last year. So that's how it came to be. We had no idea whether it was going to work. We were very anxious in getting a lot of people involved, got more than 150 people involved. And Rose and Traco have been instrumental in that entire process.
Thank you. And just touching on that, Rose is from Kings County, Traco is from Kern County. Clearly, this is a regional study. Elize, maybe just can you touch on what counties does the healthcare landscape analysis cover, and how does the population of the Central Valley reflect the current healthcare system?
Sure. I'll start with the first part. We initially set out to do 6 counties. There's 6 counties that the Central Valley Community Foundation traditionally works in: Fresno, Tulare, Kings, Madera, Mariposa. And we were looking at Mariposa and Kings. Did I miss Kings? Sorry, Rose. And so we were going to originally look at Kern as kind of a baseline or a comparator, thinking that their outcomes might be very different. We had a hypothesis which that they, because of industry and oil, that they might have a lot more employer-provided healthcare, so their outcomes might be better. But when we started looking at the secondary data, found that they were actually pretty similar to the rest of us. And so we decided, rather than using them as a comparator, to use them as a full-fledged site. And we're so happy, reached out to Traco, who got us engaged in that county. And so we were able to pursue a 7-county region.
Thank you. And Traco, going to you on this one, how does the Central Valley compare to the rest of the state when it comes to health access, equity, and outcomes? And we'll discuss this in more detail coming up, but just as a general broad overview, how do we compare?
No, I'd say the punchline is we're not doing as well. And so we certainly have more challenges here in the Central Valley, and we'll talk about what some of those challenges are. But one big issue is there's just more rural. And so here in Kern, we are a rural county, one of the few rural counties in the state, meaning we have just over 900,000 people, but we're a county the size of the state of Connecticut. And so when you have geographical challenges like that, healthcare by default is more costly. And also inequities persist because it's just harder to get folks to the care that they deserve.
Thank you. And up next, we'll discuss the most prominent difficulties facing the current healthcare industry in the Central Valley. This is the Maddy Report. Welcome back to the Maddy Report. I want to shift our attention to other prominent issues facing healthcare and equity in the Central Valley. The region continues to face difficulties regarding insurance coverage gaps, workforce shortages, and financial insecurity. Traco, I'm hoping your background in health equity may be able to lend some insight here. Thanks again for being on the Maddy Report, and also to you, Elize Bradley and Rose Rahn. According to the report, 53% of Central Valley is covered by Medi-Cal with a 5.9 uninsured rate. What prevents members in the Central Valley, particularly farm workers, from being insured, and how drastic of a change will we see in uninsured rates once we might see some state or federal budget challenges? Traco, why don't I go to you on this one?
No, thank you for allowing us to come on and talk about this incredible transformative report. But yes, we've had challenges and inequities in the Central Valley before the passage of H.R. 1, and it really only exacerbates the issue by making it harder, causing folks to have to do more work in order to actually keep their coverage. And when you think about inequities, that's probably one of the biggest ones. So folks who are living in poverty, more often than not, they're actually working. And so if you don't have a healthcare system top to bottom in terms of coverage and clinics and hospitals that aren't thinking through that equitable lens, it's just harder for them to find time to go and renew their coverage. And so you can think of it maybe like it's tax season. And so if you're working, you have to have a tax professional that's going to stay open late or do everything in their power to make sure that you can get things done after working hours. Well, for farm workers and for other folks, they have things to think about: families, children, et cetera. And so it's just harder to keep coverage. But then even if you do have coverage, now trying to actually get to the hospital, get to clinics, for annual checkups and so forth, it's much harder. And so many of the inequities are related to, just the cost of poverty, not having as much coverage generally as folks who have higher paying jobs and get luxury of time, time off, paid time off to go see their doctors, et cetera. And so there are many challenges and equity issues that HR 1 will only exacerbate and make it that much harder for folks to actually keep their coverage, but then also to take advantage of their healthcare coverage and the healthcare systems that we do have in the Central Valley.
And Traco, why is the Central Valley falling short of the California average in key healthcare professions? Obviously, we see, the UC has expanded pathways for medical education through programs like SJV Prime. We also have, CHSU here in the Valley. Hospitals have added expanded residency programs, and programs in Tulare and Kings are helping create pipelines for K through 16 students in Fresno, Madera, and Tulare and Kings. But about half of all high schools have a health pathway in addition to these 4 counties. So, even though there's this great work going on, how is the Central Valley sort of attempting to increase the workforce in healthcare by targeting all walks of life?
No, that's a great question. And so there are many, many initiatives. I would say the heart of the issue is we still don't have enough residency programs. We need to find a way, to maybe add additional residency programs. If we can't get another UC here, we've been pushing for one in the southern central part of the Central Valley for a while. But outside of that, it's just hard to get more workforce to stay because the research shows that most of the time, if you have a residency somewhere, you're likely to stay there and raise a family there. And so we need more residencies, despite the fact that we have grown in that space over the last decade. And so most of our efforts related to workforce challenges are looking at that heart. How do we get more residencies here in the Central Valley and every part of the Central Valley? And then you're also looking at how do we get more primary care physicians? That helps to mitigate inequities. The research also confirms that. But those positions often don't pay as much. And so how do you actually attract doctors and physicians who are willing to live in the Central Valley, work in the Central Valley, when they could probably make more money in other locations around the state of California?
And Elize, just to wrap up this segment of the conversation, there have been several hospital closures in the Central Valley within the last couple of decades due to financial difficulty. How are recent legislative actions, maybe such as SB 525, Prop 35, we also heard Traco talk about HR 1 and other actions causing concern for the financial security of hospitals?
Devastating. As one of our stakeholders who we interviewed said that, our healthcare system is already on life support, and these federal attacks are now just daggers to the heart. We are just at the beginning of trying to estimate the negative impact that any one of these particular measures is going to have. We heard, in terms of indigent care, we heard from Joe Prater, our public health department, about now with more people being uninsured, people are going to be showing up. We're going to have a lot more indigent care, and we have no line item to pay for that. And so we are bracing for a tsunami of these caused by these cascading federal cuts.
Thank you. We're going to take a quick break and we'll be right back after this. This is the Maddy Report. Welcome back to the Maddy Report. I want to focus on how healthcare difficulties in the Central Valley are affecting maternal and infant health. The Central Valley Community Foundation's healthcare landscape analysis highlights that we have a maternity care crisis here in the Central Valley. Rose, Rahn, you've been very patient with the previous two segments. I'm hoping you can shed some light on a few of these topics given your background and expertise. Rose, the Central Valley falls below the California average of OBGYNs and certified nurse midwives. What are hospitals forced to do to keep up with the shortage of OBGYNs and labor delivery staff? And how are these factors contributing to the closure of labor and delivery departments in hospitals throughout the Central Valley?
There is quite a dearth of lack of OBGYN specialists as well as certified nurse midwives. And then with the additional closures of labor and deliveries in the Central Valley, and actually all the areas, Kern, Fresno County, Kings County, and our rural communities, it has really lowered the amount of OBGYN services that are available. Now, family practice physicians can do prenatal care on low-risk pregnancies. So where we have the really big problem is if you have a high-risk pregnancy in a rural area, getting access to a specialty OB care. They'll have to go to a tertiary care center or a larger city, which are already burdened with care. So we have several physicians in the Central Valley talking about how women show up in the emergency room ready to deliver with poor birth outcomes. So the other thing that we learned through this report, which I found fascinating, is not a lot of people are going into obstetrics as a care. The malpractice insurance is high. Also, babies aren't born 8 to 5, Monday through Friday. They're born after hours, and so there's not a lot of people wanting to go into OBGYN. So even our Valley numbers of how many OBGYNs we're producing is very small. So all of those factors kind of are this perfect storm for not having enough care in the Central Valley, and then impacting our outcome numbers. We have a high infant mortality rate in the Central Valley, even more significant among African American and Black mothers. Also, a significant, which doesn't get talked about, maternal morbidity report, more moms dying after delivery in the Central Valley than the rest of the state. Some of our numbers are comparable to the South of the US. So really significant numbers that we should be concerned about.
And Rose, I think you just began to touch on this, when you were talking about some of the impacts, but how do difficulties in the labor and delivery department further affect the maternal mortality in the Central Valley? The Central Valley is below the Healthy People 2030 target rate of 80% for adequate prenatal care. How does prenatal care range between demographics of different races and insurance types in the Valley?
So, prenatal care, I think Traco spoke to it in the last segment. Private insurance tend to get access to health care. They're able to take time off and get to their doctor's appointments. If you have someone who's a farm laborer or someone working a job that doesn't get time off, they won't access those appointments. They may not understand the importance of being at early prenatal care or even a high-risk appointment. Some of the clients who work in these rural farm ag areas are unable to get away from work. And then they have to drive an additional hour to an hour and a half to get to an appointment. So if you're in a rural, like I'm thinking in Kern County, if you're over in Ridgecrest working, you're gonna have to drive all the way to Bakersfield, which is a significant drive. Same with me, with families who live in Avenel, they're gonna have to drive all the way to Fresno, which are like over an hour, and if they don't have adequate transportation, it's just sort of all builds on not getting adequate prenatal care and care to prevent poor outcomes.
And Rose, doulas have been around for decades, but how are we presently investing in doulas to strengthen our healthcare system, specifically
So it's super exciting.
Yeah,
in the
go ahead.
report, that's a bright spot, so I'm glad you brought it up. There's been a real shift. Doulas have been around. Birth coaches have been around forever. So now there's really been a shift on the importance and the reduction in poor birth outcomes with the introduction of doulas.
Thank you. We'll be right back to wrap up our conversation discussing the Central Valley Community Foundation's healthcare landscape analysis. This is the Maddy Report. Welcome back. Traco, Rose, and Elize, thanks again for joining us on the Maddy Report today. I know we've been discussing a lot of the challenges facing the Central Valley's healthcare systems, but before you go, I want to highlight some of the opportunities and what can be done to rebuild our healthcare system. The report proposes critical focus areas and strategies for impact, such as catalyzing collaboration and strategic investment, sustaining the healthcare safety net, growing the workforce, and reimagining models of care. A big difficulty for hospitals has been financial stability. We talked about this a little bit earlier, but how can hospitals secure their financial safety net through Medi-Cal, even with some threats to coverage in the coming years? And maybe we'll go to you on this one, Elize.
I was actually going to pitch it to Traco.
Or we could go to Traco. Yeah, let's Traco. Why don't you jump in on this one?
Sure. Well, I am not the expert on how hospitals can be financially sustainable. However, one of the beautiful things I think about the way that our managed care system works and just our overall healthcare system works, most care, at least for folks who experience the majority of inequities, it is subsidized. And so it's going to be there. It's even with these cuts that we're experiencing or anticipating from HR 1, we're really a safety net when it comes to funding for hospitals and for clinics and for the healthcare system that is wanting to do the good work, get out into rural communities, et cetera. That's really the heart of our work, is how do we make sure that there is enough coverage and enough payment so that hospitals don't go bankrupt with their indigent budgets, having to cover and provide care for folks that don't have coverage. And so we're doing everything in our power to make sure that all of our members here in Kern County, and that's about 85% of the Medi-Cal qualified membership in Kern, we're trying to make sure that they retain their coverage. And I know that our partners, Kaiser and Anthem, are also engaged in the same work. And hopefully for every county, payers are doing everything in their power to be innovative in this season to combat the potential abrasion that HR 1 is driving. And so the more coverage we do have, the more sustainable our hospitals will be. We know that, and so that's our primary focus right now.
And I think I would add to that, now that Traco set it up, we have just egregiously low reimbursement rates, Medi-Cal rates, and we're absolutely dependent upon them. Our payer mixes include such a high percentage of Medi-Cal that it's just not a sustainable financial model. We're in essence losing money on every patient, on every Medi-Cal patient, and insufficient amounts of private pay to kind of subsidize that. So just the model is broken to begin with, in addition to just starting out with the smallest healthcare workforce in the state per capita. So we've got some some upstream structural issues that are going to make it hard for us to maintain our financial health, the financial health of our hospitals, unless those structural changes are made.
Yeah, I'll just co-sign on that. 100%. That is above my pay grade. And so it is important, I believe, for all of us in healthcare, especially here in the Central Valley, and that's what this type of report allows us to do, is to advocate to all of our elected officials, to those in power who might be able to do something about those rates and the greater sustainability of our entire healthcare ecosystem. That's the only way it's going to happen, is additional investment. This is not the time to be making cuts. This is the time to actually understand the challenges and the inequities that we are facing in healthcare in the Central Valley and find ways to invest more.
Unfortunately, that's all the time we have. Dr. Elize Bradley, Senior Health Equity Fellow for the Central Valley Community Foundation, Rosemary Rahn, Kings County Public Health Director, and Traco Matthews, Chief Health Equity Officer for Kern Health Systems and Board Chair for Governor Newsom's Racial Equity Commission. Thank you all for joining us on the Maddy Report today. Really appreciate your time and expertise. Thank you for tuning into the Maddy Report. To learn more about the Maddy Institute, visit themaddyinstitute.org. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.com.